So I'm gonna check the provider's order. It looks like I have to do a head-to-toe assessment. So I'm gonna go into the patient's room and perform a head-to-toe assessment. Right, knock, knock, knock.
Come in.
Okay. Hi, my name is Ashley Duarte, and I'm gonna be your student nurse for today. I'm gonna ask you to verify your name and date of birth for me.
Duarte Flores.
Okay. And can you tell me if you have any allergies?
No allergies.
All right. And then can you rate your pain for me from a scale of 0 to 10?
0.
0 pain. Okay. And then can you tell me when the last time you emptied your bladder was?
This morning.
This morning. And when was your last bowel movement?
This morning.
Okay. And do you have any nausea or vomiting?
No.
And then do you have any cough?
No.
Like with any, like a productive cough with sputum? None of that? Okay, perfect. Now I'm gonna ask you to remember a phrase. I'm gonna ask you to remember "I like strawberries." At the end of our assessment, I'm gonna ask you to recall that phrase for me.
Okay.
Right? And then can you tell me where you are?
At the doctor.
Okay, and then can you tell me today's date?
June 29th.
Okay, and can you tell me the reason why you're here?
For assessment.
Okay, and then can you tell me who the president is?
Donald Trump.
Okay. All right, now I'm gonna start my assessment by taking a feel at your scalp, okay?
Okay.
Okay. I'm gonna check for any tenderness, any bumps, bruising. Are you experiencing any pain while I touch?
No.
All right. Okay, and then can you raise your eyebrows for me? All right, can you smile? Can you frown? All right, and the patient's affect is positive and the patient is cooperative. All right, now I'm gonna get my pen light. All right, I'm gonna take a look at your ears for any cuts, scrapes, bruising, drainage, and I don't see any. They go on the other side. Check. No drainage, nothing. All right, and I'm gonna whisper something in each ear and you're gonna tell me what you hear, okay?
Okay. Hi.
Okay, I'm gonna do the same thing on the other side.
Bye.
Okay, perfect. Now I'm gonna take a look at your eyes. I'm gonna hold my pen light and I'm gonna just have you follow it, okay?
Okay.
And then I'm noticing that the cornea is clear and the sclera is white. And then can you pull down on your eyelids for me? Right, and conjunctiva is pink. All right, now I'm gonna have you, I'm gonna shine a light in your eye and then, pupils are equal, round, and reactive to light and accommodation. Right now I'm going to palpate your sinuses. Okay, and then I'm just gonna look at your lips for symmetry. And then can you open your mouth for me? Alright, I'm gonna take a look at my pen light for the mucosa, the tongue. It's all pink and moist. It isn't dry. Alright, I'm gonna assess your gag reflex. Okay, and then the uvula is present. Can you open your mouth again? Okay. And then I'm gonna look inside your nose. All right, mucosa is pink and moist. Okay, now I'm gonna wiggle my fingers behind your head and then just let me know as soon as you see them, okay? Okay, and then now I'm gonna do a smell test. So I'm gonna have you smell what you smell in each nostril and then tell me what you smell and where you smell it.
Okay.
Okay. Close your eyes as well. Sorry.
Berries.
Okay.
Alcohol on my right side.
Okay, now I'm gonna touch a part on your face and then you're gonna have your eyes closed and you're gonna tell me where you feel it.
Okay.
Can you close your eyes?
Forehead. Left cheek. Chin.
Okay, perfect. Okay, and now I'm just gonna feel your skin. It is warm, it isn't dry. And then I'm gonna have you push up on my shoulders. And then I'm gonna have you go against my hand. And at the same time, I'm noticing no JBD. And then the trachea is midline. Okay, now I'm gonna have you squeeze my fingers. All right, and can you push up on my hands? And can you push down? Then I'm gonna check for your capillary refill. Okay, it's less than 3 seconds. And then skin turgor, I'm gonna check right here. I'm just gonna pinch softly. Okay, and then I'm gonna check for clubbing. Can you put your fingers together? Okay, no clubbing. And then I'm gonna check your pulses. And then do you wear contacts or glasses?
Yes.
Okay, do you wear contacts?
Yes.
All right, do you have them in right now?
Yes.
And then do you have any dentures I forgot to ask?
No.
No, no fillings?
No.
Okay, I'm gonna go ahead and listen to your heart and lungs. Okay. Okay, I'm gonna listen to your lung sounds. Just take a deep breath every time I place my stethoscope. Okay. Right, and then I'm gonna have you pull down your eyelids. Never mind, I did it already. Okay, I'm gonna take a look at your abdomen, checking for any distension, no ports, no ostomies. All right, so now I'm gonna listen. Okay, are you experiencing any discomfort?
No.
I'm gonna palpate. Okay. And then I'm gonna have you lift up your legs. Okay, and then can you put them back down? Then I'm gonna check for your fetal pulses. Alright. Equal +2 bilaterally. Can you push up and then push down? Okay. Now I'm gonna check your fingers again. Your capillary refill. Oh, capillary refill on your feet as well. Okay, less than 3 seconds. Okay, now I'm gonna check your vital signs. I'm gonna put this on your finger. I'm also looking at the symmetry of her chest as she breathes in, and I'm noticing that she doesn't have any labored breathing. Okay. Okay, oxygen is 98. And then what is your normal blood pressure?
Like 116/82.
Okay. Okay, I got 118/72. Alright, and then respirations are 18. And then I'm gonna check your temperature really quickly. Can you open your mouth and I'm gonna put this under your tongue. Have you had anything cold or hot to drink in the last hour or 30 minutes?
No.
Okay, close your mouth. Alright, temperature is 98.5. Alright, I'm gonna have you get up and walk to the scale right there. Okay. Alright. And then it is 179 kilograms. Right, I'm gonna have you lean up against the wall. I'm gonna check your height. Right, it is 162 centimeters. All right, you can take a seat. Okay, and then I'm gonna have you remember that phrase that I told you in the beginning.
I like strawberries.
Okay, perfect. And then did you experience any pain during the assessment?
No.
Okay, do you have any questions for me?
No.
Okay, perfect. I'm gonna leave your call light within reach. If you have any questions, just let us know. Do you want your door open or closed?
Clothes.
And then I'm just gonna document my findings.